Welcome to Body Bites. In this video, we will be understanding heart attacks, exploring everything from the cellular mechanisms of a myocardial infarction to life-saving emergency medical interventions. A heart attack occurs every 33 seconds, meaning one life is lost. It is a leading cause of mortality worldwide, striking suddenly and often with devastating consequences. Every minute matters. But here's the scary part. Most people who experience a heart attack had warning signs days before. They simply didn't recognize what their body was telling them. This underscores the importance of awareness. Hi, I'm Rena, a nursing student and educator, and I'm your guide for this session. Welcome to Body Bites. I aim to simplify the understanding of the human body. This video is designed for everyone. Today's agenda covers three key areas: the cellular level, exploring the microscopic events of a heart attack; the symptoms, decoding the warning signs; and the medical response, focusing on life-saving interventions by medical professionals. We begin with part 1, the healthy heart. To understand a disease, we first need to understand how the normal body works, so let's start with the basics of a healthy cardiovascular system. The heart is a powerful muscular organ, the engine of life. Its job is to pump oxygen-rich blood and vital nutrients to every cell. The heart muscle itself gets its oxygen supply through the coronary arteries. What goes wrong? The setup involves two main steps. First, plaque buildup, or atherosclerosis, where sticky plaque narrows the coronary arteries. Second, rupture and clotting, where the plaque cracks, forming a blood clot that completely blocks the artery. Now we dive into part 2, the cellular level. Myocardial infarction asks, what happens when the oxygen supply is completely cut off to the heart muscle cells? This is the core event of a heart attack. It's vital to know the warning signs. These include chest discomfort, radiating pain to areas like the arm or jaw, shortness of breath due to fluid backup in the lungs, and cold sweats and nausea from the body's fight or flight response. Medical interventions are crucial for saving lives. They include rapid assessment and triage, diagnostics and medication like clot-busting drugs, and catheterization, where a stent is placed to open the blocked artery. Thank you for joining this video. It is time to dive deep into the science of the human body. Feel free to review your notes. These are the image sources used in this video. Before we can understand the mechanics of a heart attack, we need to master the healthy baseline. Let's explore how the ultimate pump operates in normal heart physiology. The heart is a muscular pump, roughly the size of your fist, located slightly to the left of the center of your chest. Its job is to push blood to every single cell in your body, 24/7. Let's dive into exactly how it accomplishes this massive feat. The heart has 4 chambers: the atria, or receiving rooms at the top, and the ventricles, or pumping rooms at the bottom. Blood flows IN to the atria from the veins, and ORT from the ventricles into the arteries under high pressure. Blood flow starts on the right side. Deoxygenated blood returns from the body to the right atrium. It moves down into the right ventricle, which pumps it to the lungs via the pulmonary artery to release CO2 and pick up oxygen. Now for the left side. Oxygenated blood returns from the lungs to the left atrium. It moves down into the left ventricle, the strongest chamber with the thickest muscle wall. This ventricle violently pumps oxygen-rich blood out through the aorta to feed the entire body. The heart operates as a synchronized double-loop system. The right side receives deoxygenated blood from the body and pumps it to the lungs. The left side receives oxygenated blood from the lungs and pumps it to the body. The heart itself is a muscle and needs its own constant supply of oxygen and nutrients. The blood vessels that supply blood directly to the heart muscle are called the coronary arteries. These main branches, like the left and right coronary arteries, wrap around the outside of the heart like a crown. These coronary arteries are extremely important because if anything happens to them, the heart muscle stops getting blood. And that is a heart attack. Remember this, as we will be coming back to it. Thank you for watching this video. The images used in this video are sourced from elements.envato.com and easy-peasy.ai. Welcome to part 2, where we uncover the silent mechanisms that lead to a myocardial infarction, commonly known as a heart attack. We will trace the journey from arterial blockages to cellular starvation. Let's decode the medical term, myocardial infarction. Myo translates to muscle, and cardial refers to the heart's specialized muscular tissue. Infarction means the death of tissue due to lack of blood supply. So a myocardial infarction is the permanent death of heart muscle due to severe oxygen deprivation. The setup for a heart attack is atherosclerosis, a silent process. Imagine your artery is a water pipe. Over years, fatty plaque builds up on the inner walls, narrowing the artery and severely restricting blood flow. This gradual process occurs with no symptoms, making it incredibly dangerous. Plaque is a sticky cocktail of cholesterol, calcium, and inflammatory cells. Factors like high cholesterol, smoking, and diabetes accelerate its formation. This silent threat can develop for decades without a single warning sign. The critical moment begins with the rupture of this unstable plaque. The body mistakenly perceives this as an injury. Platelets rush to the site, forming a blood clot directly on the rupture. In minutes, this clot completely blocks the already narrowed artery, instantly cutting off all blood flow. This begins the ticking clock. Heart muscle cells are extremely sensitive to oxygen deprivation. When the artery is blocked, blood and oxygen stop reaching that part of the heart. Within just 20 minutes, heart muscle cells begin to permanently die, and the myocardial infarction begins. This leads to the golden rule of emergency medical protocols. Time is muscle. The faster you treat it, the more heart you save. This underscores the critical importance of immediate medical attention. Welcome to this video, where we will take a deep dive into the cellular mechanics of a heart attack to understand what happens inside the body during this critical event. The heart's engine is composed of normal heart muscle cells called cardiomyocytes. They work constantly, 24/7, to pump blood and require a continuous supply of oxygen, glucose, and nutrients delivered exclusively by the coronary arteries. During a heart attack, a coronary artery becomes blocked due to plaque rupture and blood clot formation. This halts the vital flow of oxygen and nutrients, plunging the cardiomyocytes into a state of severe crisis. In phase 1, ischemia, the cells are starving. They switch to anaerobic respiration, producing lactic acid. This buildup causes severe chest pain known as angina. Importantly, cells can still be saved if blood flow is restored at this stage. If blood flow is not restored within the 20-minute window, the process enters phase 2, infarction. Cardiomyocyte death is permanent and irreversible. As cell membranes rupture, they release their contents and specific enzymes into the bloodstream. These released substances are used as diagnostic cardiac biomarkers. Elevated levels of specific enzymes like troponin I, troponin T, and CKMB confirm a heart attack. These markers rise within 3 to 4 hours and can stay elevated for up to 14 days. Phase 3 is remodeling, which occurs over days to weeks. The dead heart muscle is replaced by scar tissue that cannot contract, permanently reducing the heart's pumping ability. Severe damage can lead to progressive heart failure due to the strain on the remaining healthy muscle. In the event of a heart attack, every minute truly matters. Quick treatment is critical because time is muscle. Recognizing the symptoms and seeking immediate medical help is essential. Welcome to this video on nursing care and treatment for acute myocardial infarction. We will be covering the clinical guidelines, the MONA protocol, and the primary medical interventions used for this condition. Immediate intervention involves the MONA protocol. Morphine is for pain relief, reducing distress and heart workload. Oxygen is crucial if saturation drops below 94%, ensuring perfusion to uninjured heart muscle. Nitroglycerin is a potent vasodilator, improving blood flow. Aspirin, 300 to 325 milligrams, is a rapid-acting antiplatelet drug given immediately to prevent further clotting. The first primary treatment is thrombolysis, a clot-busting intravenous therapy. Drugs like streptokinase, or TPA, are injected directly into the bloodstream to dissolve clots and restore blood flow. This is most effective within the first 3 hours of symptom onset. Primary treatment 2 is percutaneous coronary intervention, or angioplasty. A catheter is threaded to the blockage site. A balloon is inflated to compress plaque, and a metallic mesh stent is deployed to keep the artery open and prevent collapse. Primary treatment 3 is coronary artery bypass grafting, or CABG. This major open heart surgery is used for multiple, severely diseased or blocked arteries. A healthy blood vessel is harvested and grafted to the heart, creating a bypass route to restore blood circulation. Core nursing responsibilities include continuously monitoring vitals and the ECG for arrhythmias. Immediate interventions involve establishing IV access and administering MONA. Also, manage the patient's psychological stress and constantly assess for acute complications like cardiogenic shock or heart failure. Let's take a moment for a quick recap and review the critical concepts we learned today about heart attacks. The foundation is that the heart pumps blood through circulation, and coronary arteries supply blood to the heart muscle. The problem is that atherosclerosis narrows these arteries, and plaque rupture can cause a clot, completely blocking the artery. This blockage causes a myocardial infarction. Key symptoms include chest pain, shortness of breath, and nausea. Be highly alert for silent heart attacks in women, the elderly, and diabetics. Treatment involves MONA, thrombolytics, and primary PCI. Our job is to act fast, because time is muscle. I hope this video helped you understand heart attacks not just as a disease name, but as a complete story of what happens inside the human body. If this video added value to your studies, please support the channel by liking the video, subscribing for more deep dives, and commenting below with topic suggestions. I read every single comment. Thank you so much for watching. Take care of your heart. I'll see you in the next video.